Hello guys, this is Ford
Omar and Brandon.
set from Mr. Estevez's third block class on 8A, shedding light on mouth cancer and how fatal it can be to a
Oral
person.
cancer starts by a small bump on the lip that over time can turn into a tumor. The tumor spreads cancerous cells by cells breaking off and going through the bloodstream. And these cancerous cells can go and multiply in important parts of the body. And the small bump on your lip can cause discomfort, numbingness, or unusual bleeding, which is one sign that you may have this cancer. And it affects the body by a sore on the lip or mouth that does not heal, a lump on the lip or in the mouth or the throat, unusual bleeding, pain, or numbness in the mouth, a sore throat that does not go away, or a feeling that something has caught the throat, difficulty or pain with swallowing or drinking, swelling of the jaw, pain in the ear, or a change of voice. That's it.
Oral cancer is to avoid it in general. Positive lifestyle choices such as not smoking or
He smokes with
chewing
cigarettes.
tobacco and drinking in moderation will greatly lower the chances of developing mouth cancer. Smoking, especially cigars and pipe tobacco and chewing tobacco, are more effective at developing the cancer because cigar and pipe smoke isn't inhaled and the nicotine and other carcinogens are absorbed through the lining of the mouth. Chewing tobacco or dipping is probably the fastest way to develop mouth cancer because the tobacco is placed in between the lips and gums and is sucked of its juices for long periods of time. Aside from avoiding toxins, another way to avoid this cancer is to have good dental hygiene by brushing your teeth daily and looking out for red or white patches and ulcers that haven't been cleared up within a couple of weeks. While in the sun, use a good ultraviolet protective cream that is specialized for the lips. Also, having a healthy diet and intaking all vitamins necessary will help a lot because fruits and vegetables generally protect the body from many illnesses, including cancer. From the articles I've read, I've learned a lot about mouth cancer and how detrimental it can be if it's not caught early enough. I knew that tobacco use and alcohol use were the greatest factors to getting this cancer, but I never knew that HPV could play such a big role in developing this cancer. Mouth cancer has a higher fatality rate than a lot of other cancers, such as cervical cancer, and it is very hard to treat because most cases of mouth cancer aren't caught early enough and they are usually caught in the later stages. One last thing I've learned about mouth cancer is that it is absolutely disgusting, and I will do anything to make sure that I won't get this cancer.
Hello guys, this is Omar, the doctor who is going to tell you about how us doctor diagnose and serve the cancer. The cancer is nearly always diagnosed by an expert who has looked at cell or symbols under a microscope. In some cases, case- cases, test done and the cells, protein, DNA, and RNA can help tell the doctor if there's cancer. This is test are very important when choosing the best position. Cancer cells are dividing, re, dividing. They break down much faster than normal cells. The increased activity will showing up on ABET scan and can both primary and also less use of mouse cancer definition. The project I have learned a lot about mouse cancer and how it is diagnosed. I have know that tobacco use is a great factor, but I don't know about HPV being a factor. I also learned that it is looked at on a PET scan, and I don't think that most people would catch the cancer too late and would die. I had prior knowledge that the treatment process would be difficult because the mouse sugary would be very painful, and the mouse is a good place to breed mal- malge- mal- malig- mal- malignant
Wait, malignant.
malignant cells.